My name is Brianna Russell, and I am a student physical therapist assistant with Jeff State. And today I am going to be talking to you about Cushing syndrome. Cushing syndrome is a rare but life-changing disease that affects 10 to 15 per million individuals each year. Symptoms that may indicate the presence of Cushing syndrome are
weight gain in the trunk, full, round, and red face, fat accumulation between the shoulders, decreased fat on arms, legs, and buttocks, purple striae 1/2 inch or wider on the abdomen and breast. Children may have impaired growth, depression, anxiety, changes in behavior, backache, bone pain, fractures due to osteoporosis, muscle weakness, hypertension, diabetes, dyslipidemia, visceral obesity, increased urination, increased thirst, fatigue, or headache.
So that is a lot of symptoms. Now the question is, what exactly is Cushing syndrome, and what sets it apart from other problems such as ordinary obesity? Cushing syndrome is classified as a rare disease that is caused by a surplus of cortisol within the body. Now you may ask, what is cortisol?
Cortisol is a hormone produced within the adrenal glands of the body to help regulate stress and maintain bodily homeostasis. It is also known as the stress hormone. When the body is under high stress situations, such as during an attack or a hectic day at work, or when preparing for those final exams and practicals, the pituitary gland releases ACTH, which communicates with the adrenal glands to release cortisol into the body. Now, just because you are a stressed out student studying for final exams doesn't mean you will develop Cushing syndrome. Remember, Cushing syndrome is due to the presence of excess amounts of cortisol in the body, which throws the body's homeostasis off balance, producing symptoms such as extreme weight gain. This excess can be due to factors such as an overabundant intake of glucocorticoid medication or due to the overproduction of cortisol within the body. There are several different pathologies that Cushing syndrome can follow. Iatrogenic Cushing syndrome. This is caused when an overproduction of glucocorticoid medications are taken. ACTH-independent Cushing's syndrome. This is caused by a tumor on the adrenal gland. ACTH dependent. This can follow two different pathologies. The first being when a tumor is present on the pituitary gland, causing the overproduction of ACTH, also known as Cushing's disease. When a tumor is found elsewhere in the body in other organs and causing the overproduction of cortisol, this is called ectopic Cushing syndrome. Tests to diagnose Cushing syndrome include the dexamethasone suppression test, the 24-hour urine test, the ACTH stimulation test, ACTH blood cortisol test, blood sugar test, and saliva cortisol levels test. CT scans and MRIs can also be used to help pinpoint any tumors. Medical treatments can include decreasing glucocorticoid medication dosage or surgical removal of the tumor. However, if surgery cannot be performed, radiation is an alternative option. Now, what is the role of physical therapy? Cushing syndrome can be classified under the preferred practice pattern primary prevention, risk reduction for skeletal demineralization. Impairments that can be addressed include muscle weakness and decreased joint mobilization. Interventions can include aerobic exercise to assist with weight loss, weight-bearing exercise to help increase bone density and avoid the complication of fractures due to osteoporosis, gait training to increase ability to ambulate, and patient education for things such as fall prevention to decrease risk of fractures, broken bones, and other injuries. The prognosis for Cushing syndrome is generally positive. However, patients may still live with physical, psychological, and cardiovascular impairments for the rest of their lives, and unfortunately, there is a probability that the disease will return. If left undiagnosed and untreated, permanent life-threatening effects such as increased blood pressure, intensifying diabetes, heightened risk of stroke, heart attack, and the inability to heal injuries can all lead to morbidity and mortality. For the best prognosis, early detection and treatment is important.
Cushing syndrome may be a rare disease. However, it is one that can cause life-changing and even life-threatening effects. Through bringing awareness to Cushing syndrome and its symptoms, these effects can be minimized and perhaps prevented.
For more information on Cushing syndrome, you can go to http://csrf.net.